There are at least 40 or 50 different types of congenital heart disease. Some are very straightforward, some are very complex, and they all affect the structure of the heart and the physiology of the heart in different ways.
It can involve malformed chambers, tight or stenotic vessels, or transposed arteries. And these defects alter the hemodynamics, often causing poor blood to circulate to the body or forcing the heart to pump at dangerously high pressures, which eventually lead to heart muscle fatigue or failure.
Baby needs to eat and grow and thrive, and that requires a normal amount of blood flow out to the body and that normal amount of oxygen in that blood so that all of those developing processes can take place. So in very severe forms of congenital heart disease, the heart is just not capable of doing that. And so we often will need to make modifications to augment the heart's ability to do what it needs to do.
Treating a child is more than just treating a heart. It involves obviously close collaboration between numerous specialists and caregivers to optimize what is the best plan and the best treatment for any child and their family.
In order to make those diagnoses, we have to really understand the anatomy, with the way the heart works, what we call the physiology.
The type of imaging and advanced diagnostic techniques we have here allow us to understand precisely what we need to do.
We're lucky to have experts in specifically congenital heart imaging to process them in ways that allow us to understand exactly what's going on. And these days to even print models of the heart. So ahead of any intervention, we can look at the heart as a printed model and understand things in 3 dimensions.
Care of the congenital heart patient is a team sport. Although I do the operations along with the surgical team, I couldn't do that without an anesthesiologist, a nursing team, a cardiology team to do the diagnosis, a critical care team to take care of that patient afterwards. Specifically in the cath lab, more and more things are being done in a less invasive way, which is good for everybody.
We're now able to allow babies to avoid an operation even in the very first few days and months of life, either not needing surgery at all, because we're able to completely take care of the problem with a catheter-based approach, or at least to delay the need for surgery.
Sometimes we can do a single operation or a single procedure and take care of something once, and they don't have any other interventions the rest of their lives. Other times it requires a series of operations and continued management through their entire life.
We offer the full spectrum of care, from cutting-edge medical management to ventricular assist devices that act as a bridge to heart transplant.
We are the only program in the state of Connecticut right now that has an active children's heart transplant program.
We have a dedicated pediatric transplant infrastructure that manages everything from high acuity surgical periods to the lifelong immunosuppression management that's required after heart transplant.
One of the advantages to our center is that we are well integrated with our experts in adult congenital heart disease, who really we are able to hand off our young children to as they get older and reach adulthood.
In fact, now there are more adults with congenital heart disease, because they've survived, than children with congenital heart disease. And this gap will continue to increase over time.
Yale is a well-known research institution, and we bring to bear that experience in the space of congenital heart disease.
This research includes new type devices that might be put in the cath lab. They include new type of regenerative valve technology that we're developing to use in the operating room. It includes researching the genetics of congenital heart disease, which allow us to understand why congenital heart disease forms, and understand the different classes of congenital heart disease and the different risk categories.
What can we anticipate for how their heart is going to function in the long term? How will it tolerate an operation? Is there an operation that might be better for this patient because of a particular problem with their genetics?
And we're also researching the outcomes-based data to improve the long-term quality of life for transplant recipients. So we're moving beyond simple survival to ensuring these children can lead active lives and full lives.
These are all areas that tap into the depth and breadth of expertise, both in cardiology, but also outside of cardiology, because of the institution that we're in.